Major General Henry Masiko, the Joint Staff Political Commissariat, has been leading a monitoring and evaluation team from the Ministry of Defense and Veteran Affairs to inspect ongoing construction works projects by the Uganda People's Defense Forces Engineering Brigade in West Nile sub-region.
In this period, we chose to inspect projects in northern Uganda, heavily in West Nile, but we are going to end with the central north in Lango. There were projects undertaken in Pakwach, two of them, one in the Pakwach Health Center 4, Health Center 3, I think. It's on course, works are almost complete. There was slight delay, but it's understandable because January, December, and part of Feb, our engineers were mobilized to get involved in Tarehesita. So projects which were to be completed within the period of December, January, got affected a bit, but that has been explained, and that's what I found. There was uneasiness in Pakwach, a bit in Maracha. They were asking why the delay, but we told them that that hitch has been sorted out, and we expect these projects I've gone to be soon delivered. So generally, I didn't find any disappointing works. Small gaps we shall recommend to our top management, and who in turn will discuss with the clients. So generally, all the projects are being undertaken by UPDF in northern sector are on course.
My name is Omito Robert Steen, the district chairperson, Pakwach District Local Government. I man the gate to West Nile with the historic Pakwach Albert Nile Bridge. We are very privileged to have maternity extension at Pakwach Health Center for new site that later, this site next to the district headquarters, Kapita, received the sum of 514 million Ugandan shilling in the year 2023 to extend and construct a maternity block to support the population and to form part of the hospital in future as we make strategy to shift the dilapidated health center 4 that was condemned long time to a new site that will later translate or culminate into Pakwach Hospital. To date, the UPDF has seen the work executed amidst some challenges of delays which we attributed to lack of meetings, and then challenges of supplying materials in time. Though whenever there is material, the UPDF have been doing their work without rest. And it's in my observation that value for money is truthfully reflected on the work, both quantitatively and qualitatively. In terms of quality, I rate the work as being very excellent. And also when we look at the components like CCTV camera, and then even other facelift that they are doing to the facility that earlier existed, but which was also dilapidating very fast, getting dilapidated, I realized that it has gone much more better if maybe we had followed a very long chain of procurement. I would also implore our government, and more especially the president, to take interest in also construction in schools, because so many classrooms we have challenges of classrooms everywhere, but you realize big money does small work because of the challenges and the bureaucracies which are involved in procurement making projects very costly and expensive. If we were to follow that procedure, normal government PPDA procedure to execute this project, and more was procured nationally like hybrid projects, 500 million wouldn't have achieved this great work that we are seeing. It would have gone at not less than 1.5 billion. Just like the project that we had, which was procured nationally behind there, that the UPDF is going to facelift amidst even this great construction that they have put in place. That structure costed about 1.2 billion. And yet that time cost of material were low as compared to this one which is executed in the financial year 2023-2024 by the UPDF, when cost of materials are shot high. So we congratulate the UPDF. I've already committed that I will become their ambassador as they finish.
The team's primary focus is on evaluating infrastructure projects, including health centers and schools, to assess the quality of work done and provide constructive feedback for improvement.
Starting the northern inspection, northern region projects of CBD contracted by MDAs. Like today we are here at Pakwach Health Center for extension. And it's very important. This committee is a must remain. It's not tourism. This is very necessary to keep the trust of the command-in-chief in UPDF. Because if we don't keep inspecting, we may disappoint our command-in-chief. So we are happy we've inspected this project, and we've been told it's going to be handed over in 2 weeks' time. And the district leaders are happy. The quality of work, the engineer on the ground for the ministry, for the district, we have not found the representative of Ministry of Health, but they are happy, and I am also, as a lay person, I'm happy with the work which we were given. And fortunately, we were superimposed over another contractor who had done work which disappointed the president, I think. So it may be very difficult eventually when we are handing over, because there is work which was done by another contractor. But we are sure we've done good work. The challenges we have observed, and they will be in our report.
My name is Ochakachon Geoffrey Vola, the district engineer of Pakwach. Yes, I would say that the quality of this work is standing. This is what we expected of our brigade engineering department compared to other contractors where we need to push for quality. Here we did not. We did exactly what was required of us. We used the working document. Everybody understood it, so that we achieved the quality which is desired. The only challenge could be, in Junam, our land has a different characteristic. The soil texture does not favor so much structures that we begin to experience some cracks showing up. But this does not mean that we did not achieve the quality required. The desired quality has been achieved. We worked hand in hand with the UPDF Brigade as the district to ensure that the materials procured are of good quality. We even showed them where the good materials could be achieved. Those which had test results is the ones which we brought on site. So the quality, ideally, I don't have any doubt about it. The quality is good.
Leaders are happy with the quality and value for money. They are very happy. they had a reservation on the speed, and the speed wasn't also explained. That will be in our report.
As part of the evaluation, the team visited extension site of the maternity ward block at Pakwach Health Center 4, where they noted that the project has faced delays due to challenges in transporting materials to the site.
Every 3 months, we finished Central Region recently. Now we are going to comb Northern Uganda for all the projects which are being undertaken by our engineers in Northern Uganda. We do it every 3 months because, not because we are also bureaucratic, but we also have other duties. So we structure so that in 3 months, like this March, I have dedicated it to this Northern Uganda inspection.
My name is Dalili Arake Moses. I am the Chief Administrative Officer, Pakwach District. We are glad to His Excellency the President for issuing directives authorizing the UPDF Engineering Brigade to undertake projects in education and health. As Pakwach District, during financial year 2023-24, we handed over extension of maternity ward, Pakwach Health Center 4, to the UPDF Engineering Brigade, following that directive. And so far, during the period of implementation, we have seen good quality of work. My challenge has been in timely completion of the work. I think that's where there's need to guide on the process of timeliness. Because this project should have taken 6 months, it has eventually moved to almost 2 years. And this is a sensitive area where the mothers are delivering maternity ward. So I think there should be guidance issued to the engineering brigade on addressing some of these bottlenecks that causes a delay. But also today I'm glad Major General Henry Masiko, who is head of monitoring and evaluation for the projects, has been on the ground. I want to thank him. That is the approach of being down to earth, which is the original NRA style of work.
So the issues of delays is the only thing that has been dragging the work. Otherwise, workmanship is very perfect. The quantity of work and quality of work is again very impressive and exceedingly perfect. I thank you.
Despite these challenges, the Uganda People's Defense Forces Engineering Brigade has been making significant contributions to infrastructure development in West Nile sub-region. The Uganda People's Defense Forces Engineering Brigade has been involved in various projects across the country, including the construction of schools, health centers and markets in West Nile sub-region.
Once again, Lieutenant Ivan President, civil engineer and the site engineer. The project name is the extension of maternity ward at Health Center 4, Pakwach District. The contract sum is 514 million. Yes, sir. Today is Friday. Yes. Go ahead. So the project name is extension of the maternity block at Health Center 4, Pakwach District. The contract sum is 514 million 652,273 shillings, Uganda shilling. The contract duration was 6 months. The site. When were you supposed to start? The site was handed over on 13th September 2023. 13th September 2023. And we were supposed to spend 6 months. 6 months. And we had commenced work on 11th September 2023. The scope of work was the substructure for both wing 1 and 2, the spar structure, including the roof. Then we have finishes. We have electrical installation. We have plumbing. The plumbing works. Installation of solar as backup power. Installation of CCTV cameras to the facility. Installation of air conditioning to different rooms of the facility, and also working on installation of electromechanical installations. That includes the ceilings, all other installations that are put on the structure. So far, we are at 98%, and we are remaining with a few items so that we can hand over the project, and at the same time handling the snags so that the defects, so that we can give a perfect structure back to the districts.
The monitoring and evaluation team's efforts are crucial in ensuring that the Uganda People's Defence Forces Engineering Brigade delivers quality work and provides value for money.
Here we are only talking of education, health, local governments, because local governments are the ones who are the end users of some of these infrastructure developments. Prime Minister's office, the Prime Minister is extremely supportive of our engineers' efforts. There is an angle we need to examine. Somebody has put out an impression that our development partners, those who give us some grants, some funds, that they don't want the projects they are funding to be undertaken by UPDF. But we need to find out who, because we've not heard that specifically there is a communication. So we may find somebody is putting it up as a myth, because frankly speaking, you find some of these infrastructure programs, the conditionalities which are put very unreasonable. You find that they claim that one contractor should have several sites, and it's been really a source of poor delivery. So we want to urge the MDAs, really they should do, because we may eventually discover that it's not true. We may find it is our own people who are not interested in utilizing the more efficient method of delivering these infrastructure development. So maybe personal reasons, because I don't see if everybody is agreeing that using the public approach of the UPDF is more efficient, is cost effective. Why would somebody say, oh, for us we don't want to relate to UPDF? Why?
Continue to get reports from the field engineer, Ivan, Lieutenant Ivan, and I want to commend. He will come to me and say, Cow, this is where we have reached. And the delays are as a result of a new instruction, a pilot scheme. Along the way, improvements will be noted through issuing guidelines. And I think that's what we look forward to. This approach is good. Using staff to do work at market price makes the work cheaper.
If this message could go out there, we need to, at strategic level, to find out who is that and to find out reason one gives that these type of resource should not go through the hands of an efficient service deliverer. So we may need to disprove this myth. We need to know who is this, even if he's a pattern. Why would you say my money can't be supportive to this is not the first time the army is being supported by foreign friends. We've been having missions, UN, the army is involved. So it doesn't mean that really the army cannot use or touch resources of development partners. So this is my concern. As I have been hearing, you hear a project that's undertaken with difficulties, yet the sector claims that their hands are tied because the money is from other sources other than government. So if that is sorted out, we shall see really now infrastructure projects done more efficiently and saving the country hemorrhage. Because you find a major project stalls for so many years. Why? They say, oh, this is funded, they put on a conditionality and so on. So that's my main observation as of now. And I want to trigger really a debate to say, who is this saying he can't trust our engineers brigade with the projects? Who is that one? Is it true? And if we find that it is just a myth, then we shall now see the army really doing more work than it is currently doing.
Their feedback will enable the brigade to make necessary adjustments and improvements, ultimately contributing to the development of Uganda's infrastructure. Pakwach Health Center 4 is almost complete, with just 2 key components left to finish: the solar installation and rainwater harvesting system.
End users are really very happy. They are very happy. I found like the oxygen plant in Yumbe is quite exemplary. It's well built because the site given to UPDF was very appropriate, because in some other hospitals they were squeezing, you don't come out. But in Yumbe, because they got a very good site, it's amazing. So this particular inspection has not brought me many disappointments. There is one when I was in the Central, I got projects which were storing reason this poor planning that you start, then you say you start, we shall be rolling out more funds, then our engineers are already mobilized. But I haven't found that situation here in the projects. Actually, there's some too we are going to end with in Lango. I am told more or less we may find them doing the last touches. So generally, this exercise, because also I think our site engineers know that somebody will come to supervise, they are doing their best. And I want to encourage them to maintain that spirit.
This progress is especially significant given the health center's history of structural issues, including cracked walls that posed a risk to patient safety. Once completed, the upgraded health center will provide better services to the community, including patients from neighboring districts and Democratic Republic of Congo. The facility has faced numerous challenges in the past, such as a shortage of oxygen, which hindered their ability to treat patients effectively. The completion of Pakwach Health Center 4 is a welcome development for Pakwach district, which has been struggling with limited access to quality healthcare services.
So there were delays. I don't want now. I'm glad the assurance of 2 weeks. And I think I want to place the family, the team, let the 2 weeks be 2 weeks. The president directed, if the projects are delayed, the citizens will pay. Actually, when the forum called the Pakwach, the community is inciting and you can't speak. They think that we have been failing in the past. So I think if there are challenges in appreciating the directives of the president, let's appreciate them very fast and deploy so that we don't frustrate citizens who seek services. I have appeared before Parliamentary Committee back, and people are putting a notice on the delays. So I think I and my office, together with you today, if we can join hands and adopt rapidly implementation strategies within the 2 weeks, define the scope of the tasks remaining, so that we deliver them, it will help us a lot. The field engineer here has been working together with my district engineer. He's done all the business so that we can confirm this. Of course, he adjusts. He doesn't behave like a soldier. He mentality, command and control. He comes down and gives us explanation. But Kyle, yes, the director was come, but he was still appreciating how to implement.
Otherwise, workmanship is very perfect. The quantity of work and quality of work is again very impressive and exceedingly perfect. I thank you.
The desired quality has been achieved. We worked hand in hand with the UPDF Brigade as the district to ensure that the materials procured are of good quality. We even showed them where the good materials could be achieved. Those which had test results is the ones which we brought on site. So the quality, ideally, I don't have any doubt about it. The quality is good.
The completion of Pakwach Health Center 4 is a welcome development for Pakwach district, which has been struggling with limited access to quality healthcare services. The health center's upgraded infrastructure will help address some of the key health concerns in the district, including malaria and other diseases. Upon completion, the renovated Pakwach Health Center 4 will offer enhanced medical services to the local community as well as patients from surrounding districts, significantly improving healthcare outcomes in the district. The Uganda People's Defense Forces Engineering Brigade works serves as a shining example of the military's commitment to supporting national development, going above and beyond their traditional military mandate.